High healthcare cost, high medical insurance premiums. Do they trouble you? Well, you're not alone. They trouble the entire country, the larger middle class. Well, guess what? The government has begun discussions with the insurance regulator, industry executives, and hospital groups on ways to rein in surging health insurance premiums, rising medical costs, and uneven claim settlement as they all strain the systems. The Finance Ministry recently called on hospitals and insurance companies to coordinate efforts to address increasing healthcare expenses and the growing burden of insurance premiums. At a recent meeting, officials discussed ways to improve transparency, streamline procedures, and create systems that could help make health cover more accessible. Now, Ministry also encouraged insurers and healthcare providers to simplify cashless claims. These measures seek to promote efficiency and reduce unnecessary variations in treatment and billing. But the bigger question, ladies and gentlemen, here is, why is this happening? One prominent reason: healthcare inflation. The rising cost of healthcare every year. Sample these numbers. They are not very interesting numbers, but here they are. Healthcare inflation in India consistently runs at 12 to 15% annually, far higher than the general inflation rate of 4 to 6%. A cardiac bypass surgery that cost 2.5 lakh rupees in 2014 now ranges from 4.5 to 6 lakhs in many metropolitan cities. Cancer treatment costs, which were 8 to 10 lakh rupees 5 years ago, now exceed 15 to 25 lakh rupees in many cities. The rising cost of critical medications for conditions like diabetes and high blood pressure further exacerbates the financial burden, with annual price increase of 8 to 12%, outpacing average middle class salary growth of 6 to 8% per year. The average middle class salary increase is less than even 10% in most cases. Now, when your medical costs are increasing at that number, your salary is always far behind. And that has been troubling the middle class. Thankfully so, now it has reached the doors of the government. Government schemes like Ayushman Bharat are facing challenges in many hospitals because of huge payments pending from the government. As of early 2025, various media reports indicated that a substantial amount, potentially over 1.21 lakh crores, was pending for Ayushman Bharat claims nationally. Therefore, in many cases, hospitals refuse to admit patients or treat them differently if the backup insurance is that of Ayushman Bharat. That leaves middle class patients at the mercy of private insurance schemes. And that, ladies and gentlemen, is a web of many knots. From both sides: faulty claims, extremely high cost of premiums, fraud, corruption, and much more on the ground. Who suffers the most? The middle class. You and me. How? Let's understand how medical insurance is priced in most cases in India. Insurers classify Indian cities into zones to balance costs. Many insurers divide India into zones. Zone 1 for metros, Zone 2 for Tier 1, and Zone 3 for the rest of India, and price policy premiums on actual healthcare expenses, with metro residents paying 10% to 20% more premium. You see, if you're residing in a city like Delhi, the premium will be higher because of pollution. Add that factor as well. If you're living in Mumbai, the premium will be higher because of vitamin D deficiency. So these are hidden costs which are usually added in the premium. Pricing in most cases depends on several factors. Insurers base their city tier pricing on the cost of hospitalization and medical services, higher incidence of lifestyle diseases, pollution, environmental risk, availability of advanced healthcare infrastructure, and of course, historical claims data. Now, the debate over higher premiums for metro residents also raises questions of fairness. Insurers may have a data-driven case to justify higher premiums, but can it treat people differently based on their backgrounds? A recent analysis by the government and IRDAI found that hospitals are inflating treatment costs for patients and overcharging those with higher covers. This is quite normal in India. In fact, movies have been made on this subject. This has driven insurers to charge higher health premiums, making coverage less affordable for some people. These are the factors which have driven government to this stage where they're consulting hospitals and medical insurers to reduce the cost. On one side is the troubled middle class, which has been shouting at the peak of their voice to bring this cost down. The government finally now seems to listen. Let's see where this development lands us. This is Abhinav Trivedi. I, along with my team, shall see you on the next episode of Mint Explains.